Pretty much every insurance company is going to have to cancel their current plans, folks, because none of the current plans out there will be able to provide coverage at the same price that they're offering today when all of the new Obamacare mandates kick in. And that begins in January. So what's happening, the insurance companies are simply getting a head start. I mean, they're revving up. I mean, they know what's coming in January, and they're not going to be able to provide. That's why you're getting either cancellation notices and new price quotes. And your premium is more than likely doubling, and your deductible is tripling. And that's the best they're going to be able to do. That means that you head to healthcare.gov or some other exchange and try to qualify for a subsidy, which is your neighbors paying part of your costs. Just this week, what is it? 76,000 people in the Virginia, Maryland, D.C. area are having their Blue Cross Blue Shield plans canceled because of Obamacare. And it's beginning to happen in Florida. And I'm sure most of you know that it happened to Kirsten Powers of Fox News. She was on Megyn Kelly last night. I don't have the audio of that, but it doesn't matter. I don't need it. I can tell you what happened. She got onto healthcare.gov. She's been an early and long advocate of Obamacare. And we like Kirsten here, by the way. I need to stress that in matters where I have been involved, she has been over the top fair, which is unusual and unique. And she's been a longtime advocate of Obamacare, nevertheless. And she admitted to Megyn Kelly last night that her policy doesn't survive, that her premium is going to go way up, and that her deductible is going to go way up, and that she was surprised. And she said that she wouldn't mind paying a little more if it would help others, but that ought to be her decision in a private charitable matter, not something forced on her or everybody else by the government. But the impetus of the story is that she was a true believer, and even she was surprised. I think there's all kinds of shock waiting to hit people. There's still true believers that believe this is going to be the greatest. People believe Obama. They believe him when he said that it's going to cost $2,500 a year less. They believe him when he told them they could keep their doctor and keep their plan if they like it. Nobody's going to be able to do that unless they're willing to pay almost double for it, which is not really keeping your plan, is it? So as this continues to roll out, and all kinds of people, low information voters, others that are highly attuned, liberal Democrat partisans, of the whole mix, are going to find what's happening here, and it's going to be interesting to gauge the reaction. CBS News, Norah O'Donnell, reported that this Obamacare rollout is not happening the way Obama explained it. Insurers are canceling coverage for hundreds of thousands of Americans because of Obamacare, forcing them to buy new policies despite Obama's promises to the contrary. This was a report this morning on CBS. Let's go to audio soundbite number 4. Jan Crawford did the report.
A CBS News analysis shows that in many of those 15 states that have their own health insurance exchanges, more people are enrolling in Medicaid than are actually buying private health insurance. And there is concern that if that trend continues, there won't be enough healthy people buying insurance for the system to work.
Medicaid experts say they're not sure why they're seeing those lopsided enrollment numbers.
Industry sources say that if we don't see some real turnaround soon, there could be big problems for the entire system.
I don't know why people are going to Medicaid. Do they really not know why people are going to Medicaid? Do they really not know that? There's concern that if this trend continues, there won't be enough healthy people buying insurance for the system to work. We're not even close. The number, 7 million minimum healthy people buying insurance and not needing it. Minimum 7 million is what it is said to require for this to work. I don't even know how that's possible. The objective of this thing is to get everybody signed up. 7 million? Anyway, even if that's the bottom line number, they're nowhere near it. Many states have 0 enrollees. Absolutely 0. Now, the thing that amuses me, and it really does, I was talking about this to Mr. Snerdley before the program began. One of the things, and you've noticed it, I'm sure, too, is slowly but surely journalists are figuring this out. There's Jan Crawford at CBS. You know what? She got her chops are Supreme Court reporting. She is a Supreme Court expert. You cannot be dumb and do that. Nora O'Donnell. She said, yes, in a revelatory report, it's not happening the way Obama explained it. One California citizen, Natalie Willis, said her insurance had gotten worse and more expensive. Before, I had a plan where I had a $1,500 deductible. I paid $199 a month, the most similar plan that I would have available to me. $278 a month. The deductible would be $6,500, and all of my care after that point would be covered by 70%. Now, the thing that amazes me is that it is journalists who are the last to figure all of this out. It is journalists who should have been the first to warn everybody that this day was coming, because we knew that it was. It's been on track. This is exactly what Obamacare is. All anyone had to do was read just some of what the law changed. All anyone had to do was then add whatever real-life experience you have to the government coming in and running something. What happens? Wild spending with no accountability takes place, drastic deficits occur, and great inefficiency. There's nothing new about that. That is the standard day-to-day operation of a government-run entity or any bureaucratic entity. These journalists should have been the first to tell people what Obamacare would mean to them. They are now the last to figure all of this out. Why don't they ask why so many young and healthy people are going to Medicaid, which is for the poor? Why are people doing that? Why doesn't anybody? They just sit here and they wring their hands over it. Oh, no. So many people are going to Medicaid. They can't figure out. They do not understand the dynamics of life, apparently. You put a brick wall in front of somebody in an effort to stop their forward progress, and the left thinks that most people will just stop. Whereas most people will find a way to climb the wall or get around it. And when that happens, they act surprised. Well, there's a reason people are not going to Obamacare. They find out what it's going to cost them, and they go somewhere else. And in the process, they're undermining the very foundation of Obamacare, all of which was predictable. But our journalist community appears to be the last to be learning this.